everybody. I'm Nina Crowley, Sika's professional affiliations and education manager, and I'm here with Dr. Leslie Golden, who's an obesity medicine physician, and she and I have been at all the conferences this fall circuit together. So I wanted to take some of the conversations that we've been having to the masses and give you guys a little insight at how some of these fall meetings went. Thanks for joining me.
Thank you for having me. It's been a great time sharing so many of these conferences with you, and we've had so many good conversations. And I think it makes a lot of sense to be able to share our tidbits and the value we've received ourselves with everyone else.
Yeah, well, it's an exciting time to be in the obesity care field, in general, but I'd imagine as a medical prescriber, you're definitely in a unique time. So tell me a little bit about sort of what's going on in the field for you and how some of the new changes have been affecting your practice.
Yeah, it is exciting. I mean, so with me, I have a private practice in Wisconsin, and I focus on weight health care, and so we've been really limited in tools lately, right? I mean, and taking a step back, we have more tools than we've had in a long time. In general, just access continues to be an issue for multiple reasons, supply chain and coverage. But here in the last few days, we had FDA approval of a new tool, Zepbound, that we've all been waiting for and excited about. And there was a lot of buzz at the conferences that we attended about the pending approval for this medication, the Surmount trial with the data for tirzepatide, which is Zepbound, and uh, and we heard so much more about other tools that are coming, right? So we have several that are now at the pharmacy, and there are several in the pipeline and on the horizon, and it was so exciting to hear about it, and then great to come home and get this approval. So now our phones are ringing off the hook,
I
wanting to
bet.
know, wanting to know when can they get it, right? So it's also great to see the community getting excited about it as well, right? Um, we talk always so much about how weight bias and stigma impacts access and even our willingness to come and seek treatment for ourselves with possible like false misunderstanding or false understanding about what could be behind our difficulties with weight and
Yeah.
so it's really wonderful to see people embrace evidence-based treatment.
And I've been seeing a little bit of a shift, in the media reporting. It had been so negative for so long, and even still, talking about Ozempic and, even calling it the wrong medication names and talk. There's so many things we could talk about that were going wrong, but I have felt like the past few months they've been a little bit more of a turn to the positive, a lot more on the disease of obesity being recognized, focus on access in more of a, I don't know if it's more of a positive way, but more of a plea for we've got to get on board and offer this treatment to folks. I mean, amidst healthcare plans cutting coverage and things like that too. Of course, that's the negative, but
We definitely have been through a little bit of a dark chapter, which was so disappointing because we, for those of us that practice in this space and take care of patients in this space, it was there was so much optimism because of all these tools, and I don't think any of us would have been able to predict the amount of negativity that came about. Uh, with the medicines and the possible misuse of medicines and misrepresentation of what happens with the medicines. And I think it is clearing up with just us being providing more education. Of course, your weight is going to come back when you stop these medicines because this is a disease. This is a chronic disease. It's not meant to have short-term treatment. So as as that message is getting out and people are understanding it a little bit more, I think things are starting to improve. And especially now with the data from the select trials, showing reduction in heart attack and stroke with the use of these medications, even for those without diabetes, I think that's huge, and that's changing the conversation. Especially, will continue to change the conversation with health insurance companies as we hopefully get more support with using them.
Yeah, and people are ready to reframe it, I think, as a health issue and not just weight, not just looks and aesthetics and things like that too. And I've seen that too a lot. And as we're talking about weight loss and BMI loss, and we've talked a lot about what are the right terms for assessing obesity, diagnosing, treating, even the language use. But even with BMI, we saw a lot. I would say one of the themes I noticed at the meeting was really sort of people starting to figure out, well, hey, if we're not going to be using weight alone as a criteria, I saw a lot more conversation about the health conditions, about using body composition as an outcome tool, and
Mm-hmm.
even the mental health and the quality of life outcomes that we see that I'm sure you see every day in your patients. But didn't you feel like that was a much bigger theme this year?
Definitely. And I loved it. Like it's probably, I was so excited to see that. I mean, I've I've always struggled with the communication around being a weight loss doctor, right?
Mhm.
Because I think it just misses the whole purpose. And you and I have had a lot of conversations about like, we make it about this number, this weight number, but it really has nothing to do with this weight number. It's what we make that weight number mean in our heads. And so I love this shift of let's figure out what the outcome is that is important to us. What is the most important outcome to that patient? Maybe it's just a functional outcome. Maybe it's, I'd like to actually get down on the floor with my grandchildren and be able to get back up. Awesome.
That's a big one. That was
That's
always what my post-surgical patients, those milestones were huge.
right, right. And so we have so many options with picking these outcomes, whether it's cardiometabolic outcome goals, whether it's functional goals, whether it's I want to be okay with my body for the first time in my life, or when we look at our adiposity, right? So the fat tissue that's in our body, and that's where those body composition goals really come into being so important because if we really are trying to treat adipose tissue and reduce excess adipose tissue, we have to be able to measure that. And we know BMI doesn't do it. We know weight doesn't do it. And that's a really important outcome when we're looking at the outcomes to choose from.
Yeah, I've had so many more conversations with people about that lately and just saying, okay, this may be something that I didn't do before, but now I've got these effective tools and people are losing a good amount of weight, but I want to make sure that along with that weight loss we're catching somebody who might be losing too fast, we're catching somebody who might be losing too much muscle and we need to tweak
Mm-hmm.
the dosage, or really focus in on getting them in with a dietitian to work on higher protein. Or I think like most of us realize when we see our own body composition, we've got to really work on that muscle mass building, preserving, and how do we do that? So I feel like that has been another exciting conversation and shift as well.
Yeah, I think it's a important concept, important tool to have to be able to measure those things because as we always, a lot of people, we like to talk about the drugs because we're just so excited to have the drugs and the tools, but a lot of us that are familiar with it, we are worried about how fast people are losing and how much muscle they're losing, because we don't want to increase frailty. We don't want to make situations worse. We're trying to improve outcomes, not put a patient in a situation where they may have worse quality of life.
Right. Yeah. And then the patient centeredness of it all, right? I think, one of the most exciting meetings that we were at was the OAC meeting, the
Mm.
Obesity Action Coalition, where it's a patient group of people who are have lost weight or trying to lose weight, who are kind of working on their general health, and that was just such a impactful meeting for all of us, with the adolescents who were there, but really just focusing on the why. It really brought it all together for me of, oh my gosh, it is so this is so crystal clear why we are all doing this, because look at the way these people's lives have changed when they've gotten good care.
Yeah, just just remembering that meeting just kind of fills me with so much positivity, and it was such a great experience. Being with so many people that have had this lived experience, love people who have had this lived experience, and just having that opportunity to come together and share that without in a safe place of like
Mhm.
and see so many people get the opportunity to learn the science behind what they've been struggling, find that
Mhm.
understanding for the first time, and also get to see the wide range of people that it impacts, right? Because there are professional football players right there that came and spoke about their experience managing their weight and how the world treated them differently when they were actively playing versus now not, and how the attitudes towards their weight shifted
Mm.
throughout their careers, and seeing the adolescents uh, bond with others, and it really shows you that we cannot treat this condition without taking in the patient's entire experience, what it means for them, and what they want out of it.
Yeah. I mean, at that meeting, I was working at our booth with body composition assessment, and I got to measure 80 patients in 2 days. It was and it was a lot, but what it really showed me was exactly how you put that, is there were no two people the same. I didn't get enough time with each person to talk about their individual story in depth, but, the way that everybody responded to their weight loss treatments or not, post bariatric patients who are on a medication 10 years later. Their body compositions all looked so different. It was distributed in different places. And so taking that, really, that was a take home for me, was this is not a disease you can say is the same for anybody. And that's why
Mhm.
you have to figure out how to get to that individual. And that's what I think, again, kind of coming full circle to the medication options, is we're all so excited because now there's two, or six. How many now do we have? Six medications in this class.
Mhm.
Whereas how many meds are there available for someone with high blood pressure? 200? And so yes, we're all very excited, but to me that is also getting to the individualization of this, and not everybody is on a GLP-1 or the combination with the GIP. These are medications that now we have in our arsenal to try, but everybody's going to have a different path. So I think that's another a big take home, is everybody's pathway looks different.
Yeah, I love that more and more we're embracing the different types, like phenotypes of obesity, or the different ways that we all, excuse me, may struggle with the different experiences of eating behaviors and reward based eating, and all the different drugs that target different pathways, and helping people understand that there are multiple pathways that could be contributing to what they're experiencing, and the more time we spend with them, the more we hear their story, we can really help just fine tune and really individualize that care for them in terms of medication, but also in terms of what the support looks like from the entire team.
Exactly. That's always been a focus as a dietitian for me, is in working in bariatric surgery. I think there's a lot of lessons that we can learn from how programs have been run for a long time. It's been a requirement to have a dietitian on that team. And so I think really moving towards, we're not, the people who are on medications are not inherently different than the people who are having surgery, maybe to a different, possibly a different level of severity of the illness, but they still need the same support from dietitians, behavioral health specialists, exercise, lifestyle coaches, all of that. I think that's to me, that's another big, let's not start from scratch now that we have medications. Let's remember that, the interdisciplinary care is valuable. Each person brings something different. And I can't imagine, for an obesity medicine physician in a practice where it might have just been you for a long time because you didn't have as many options, and so there wasn't as much volume, and all of those reasons. But now it's like, now you've got to scale, you've got to include more people on the team, and that benefits everybody. That helps really get that patient the best care from all the best providers, which I think is, again, super exciting.
Yeah, I hope we're getting into a phase where there's more support for us to be able to take advantage of that structure, right? Because it has been widely beneficial for patients within the bariatric surgery programs to have all of those elements there for their support. And because outside of the bariatric surgery programs, a lot of payers have not really embraced paying for medical care for the disease of obesity. It's been a struggle to create what we know is needed, what we know will benefit the patients, but there hasn't been a really solid reimbursement structure to support that. And to date, a lot of practices have developed like cash based or direct programs, but a lot of patients across the country they don't have access to that. So as we continue to improve access, we improve coverage, we can start to expand our programs modeled after ways that we know have already been effective.
Yeah. And I think that benefits everybody because your time may not be best spent sitting there counseling about nutrition, although I know that you are really good at that. Because, so it's as more, and I think because more and more people would qualify for medication than they did for surgery, it's coming to light where we would say, okay, we're really talking about a significant amount of the population, right? If
Mm-hmm.
42% of Americans have a BMI over 30, and we're still using that as the criteria, as a cutoff. That's a lot of people who, we know not everybody's seeking care, but that's a lot more people to connect with than we would see if we were doing the surgical practices with a higher BMI level. So I think more and more we'll see more of that. And again, at these meetings, that is what my take home feel is pretty hopeful this time. This year it hasn't been. I've been in the
Yeah.
field since 2007, and there was a lot of you know inertia at some of the treatment options, and so I feel excited that we're moving in that direction.
Yeah, I agree. I appreciate it. I think at one of the conferences there was a kind of joke made about for year after year it was like keto amphetamine, and now we continue to have more and more tools and just a much more comprehensive approach, and and I think it will continue to improve. I think we are seeing this tipping point. That was a big discussion at one of the conferences. Like we're at a tipping point in our field, and I couldn't agree more. And it does bring about a lot of hope in a field that takes care of a community that has been long waiting
Yeah.
for a reason to be hopeful.
Yeah, that's perfect. Well, any other take homes that we didn't hit on? I mean, there's a lot of deep scientific stuff. I know you've been posting daily, trying to do daily recaps, and there's even too much in that regard, right?
Yeah, I tried. I mean, at Obesity Week, there was just so much goodness, and I loved how much there was a lot of focus on the psychological aspect, like just the complexities of eating behavior, and that's another exciting thing for me. I mean, I'm just personally fascinated by our behaviors around food and eating, and I really loved seeing the amount of work that's going into that, the different areas of the brain that are involved, and how our history of adverse child events and traumatic experiences and our coping mechanisms and how all these things come into play as well too. And it just reinforces that we can't treat this disease successfully by looking at a narrow window, right? We really have to look at what what the patient is experiencing in all aspects of their life to be successful. So, but there was way too much to try to post as
I know,
often
I know.
as I wanted to share. So, yeah,
Yeah, but I think that's a good problem that we have, and now we have a couple months to digest it before we get into the spring.
right. Yeah, just 5 months, right? So,
So, well, thank you so much. If anybody, wants to see you or follow you, where can they find you?
so weight and gold wellness is my practice because I just like to support the idea, that all of my patients are worth their weight in gold, no matter where they're at, as we're working on their journey. But we're in Watertown, Wisconsin. We can see patients virtually throughout the whole state of Wisconsin, and we also post on both Facebook and Instagram on Weight and Gold Wellness support and encouragement and tidbits. So please follow along so we can continue to share and support as many as we can.
Great. Well, thanks again. I'll look forward to seeing you at the spring circuit. All
Sounds great. Thank you for
right.
having me.
Thanks.